The content of this podcast has not been evaluated by Health Canada or the FDA. It is educational in nature and should not be taken as medical advice. Always consult a qualified medical professional to see if a diet, lifestyle change, or supplement is right for you. Any supplements mentioned are not intended to diagnose, treat, cure, or prevent any disease. Please note that the opinions of the guests or hosts are their own and may not reflect those of Advanced Orthomolecular Research Incorporated. Welcome to Supplementing Health, a podcast presented by Advanced Orthomolecular Research. We are all about applying evidence-based and effective dietary, lifestyle, and natural health product strategies for your optimal health. In each episode, we will feature very engaging clinicians and experts from the world of functional and naturopathic medicine to help achieve our mission to empower people to live their best lives naturally. Welcome back to Supplementing Health. This week, I am chatting with Dr. Pam Wilson about sources of stress, the effects it has on your health, and tools we can use to manage the impacts. Welcome, Dr. Wilson. Thanks for joining me today.
Cassie, thank you very much for inviting me. I'm very excited to be able to work with AOR. You're a great company, and this is a great opportunity for all of us to educate the consumers.
Agreed. So what the body recognizes as stress nowadays is not necessarily what we inherently think of stress, right? There's so many new forms of stress that are impacting us day to day, like our phones and our technology and the traffic we drive in day to day, and all of these other little things that we aren't historically wouldn't be labeled as stress. So what are some of these other hidden sources of stress that our body can be dealing with that we wouldn't necessarily think of right off the bat?
Right. It's a great place to start, because if we don't understand where stressors are in our lives, we don't know how to modify them. When we look at stress, it can actually be bad or negative things, or it can be good things as well. And that's often where they can hide. And as you said, now we have a lot more stress with technology and screen time and phones, etc. So stress has always been looked at as not enough hours in the day, job stress, family illness. But the good things like planning your wedding, starting a family, a promotion at work, moving your home, these are good things, but they're also going to trigger this physiological stress response in the human body. So we have to step back and identify how our body's reacting. And sometimes our bodies will tell us where that hidden stress is. But we have to look and see that it's things that are negative and also some things that are positive. They can both impact us.
Yeah, absolutely. I think it's good to take that inventory when you are feeling stress and kind of see what could be playing into it. And science has linked chronic stress to a number of illnesses throughout different studies. Can you share how that unmanaged stress plays into potential illness?
Yes, we know that the body wants to hang out in this place of balance or harmony. It's known as homeostasis. And we also know that when there's chronic stress in our bodies, it has a cost to our energy load and to our metabolism. So this chronic stress and the cost it has to our body and depleting of our body, it's known as an allostatic load. So we have to know that if we have constant ongoing stressors and this stress response is kicking in to manage it, it's going to deplete our metabolic reserves. So a really good example is that in the stress response or the fight or flight response environment, our body is going to release a lot of glucose from body tissues to give us the fuel that's going to be demanded for that fight or flight or that stress environment. And when this goes on and on, our body then starts to decrease our insulin's sensitivity to the glucose so that we can continue to get that fuel to our body for fight or flight. So this is often one of the first places that we step into cardiometabolic syndrome, And it might be just more of a hypoglycemia. People are feeling that they've got a little brain fog, they're hangry if they haven't eaten in the last 4 or 5 hours. So absolutely, the ongoing stress, it's unmanaged. We know that physiologically it leads to changes in the body and chronic illness.
And I know on your website you talk about your three pillars of resilience, which are eating well, moving well, and thinking well. So, does stress management tie into all three of those pillars, or are there specific pillars that focus more on that stress management piece compared to others?
Well, it really is all three, and it depends on the individual walking into my office and where I might put a higher priority. But as a general rule, if we're not eating well, we're not supplying our tissues with nutrition, so they can't continue to deal with the stressors of life. And if we're eating the wrong foods, we're going to start creating inflammation in our body and in our tissues, and that affects our body's ability to handle the stress response. Movement, it's just so critical because we know that exercise, when done at appropriate levels, it can help our body manage and deal with stress. But I'll have patients come in to me that are training for ultra marathons or Ironman triathlons. And if somebody pushes too hard based on all the other stressors in their life, we can see that too much movement will also be too much of a stressor. So proper movement and proper exercise is something that I always think we have to pay attention to. And our thoughts actually affect the cellular chemistry in our bodies. We always have to think about what we're thinking about, because if we don't, we can have this stress be unmanaged and unresolved and ongoing, which, as we just said, leads to chronic illness. So it really is all three areas.
And does it become more difficult to undo the effects of stress the longer that we're poorly managing it or the longer that we're exposed to excessive stress levels?
I believe yes. I see in my practice that it depends on the mindset of the individual, where they are in not just the quantity or how much of this stress load they're getting, but what their coping strategies are. So if somebody comes into my office, or we have somebody who has stress management protocols, they meditate, they do exercise, we usually can help them get to a place of health a lot faster. But I think that there are so many people that have lost hope and have that attitude of, my life is so busy. I just, I don't feel well. I have illness. I just don't see a way out of this. And if their mental approach is at that level, then it's going to be harder to help them manage their stress. So it's not necessarily the duration of the stress. I think it's also the individual's ability to handle, recognize, and cope with the stress. So it's kind of a whole package, not just necessarily time.
And you were talking about like the mental piece of it or like the cognitive piece, and you talk about identity narratives. Can you elaborate on those and speak to the ways that your self-talk contributes to stress?
Yeah, that's kind of, just kind of moving on from the last, you know, topic we discussed. Identity narratives is basically, it's this concept of us reconstructing our past based on our perception of it and our perceived present. How are we interacting and feeling about now? And then it's like, how are we imagining what our future might look like? So if somebody has self-talk that is very negative, I never can get it right. I never can lose weight. I'm always sick. I'm always in pain. I don't have any, strategies to deal with all that's going on. That person is going to probably perceive right now that there is no hope for their imagined future. So I want to make sure that I'm going to step back and say, all right, what is your self-talk? And I will encourage them to talk in the present as they're visualizing the future. It's the old self-talk of the mantras. I am healthy. I am strong. I am fit. I can handle this. And if you say it in the present as if you are handling it, your brain literally rewires itself and says, okay, we can handle this. I'm good. Let's go. So this is just what's so exciting about, the recent understanding of epigenetics and quantum physics. We literally can see, understand, and measure how our brain and our cellular chemistry, it changes based on our story, our narrative, and how we perceive ourselves. So it is important to work on that aspect of our mental emotional health. And it's one of the areas that we can actually intervene for stress management.
Can excessive positivity, or sometimes labeled as toxic positivity, have a stressing effect on the body? Because I know here we're talking about that positive self-talk. Can it go too far in the positive direction?
That's a really interesting question. Well, I would be primarily giving my opinion on this. I haven't read any studies on that, but after 32 years in practice, I would say that positive is always the side we want to drift towards. However, if somebody is in a state of denial and not stepping back and developing strategies to deal with the stress and not acknowledging that it does exist, my opinion would be that you can go too far in that direction. There has to, again, be that balance and that homeostasis.
And are there different coping strategies that you would give someone depending on age or life stage, or is it kind of the same set of potential tools for everyone?
The tools are very similar, but the tool that we choose at any particular point in time is going to be based on where that person is on their stress scale, or whether they're just so burnt out that they are physiologically in chronic illness, or whether they're on more earlier stages and they're just not sleeping well and their cortisol levels are too high. So it's really a matter of looking at each patient individually and seeing where they need to start.
So speaking of that physiological piece, one of the effects of stress that we know of can be on cognition, and like lots of people refer to brain fog or those sorts of things. What are some of those effects, speaking more in like physiological terms, that occur when it comes to cognition and memory?
Okay. Basically, what happens is that when we're in the stress response, we are in that fight or flight mode. And physiologically, we know that certain things happen. And some of the more, prevalent concepts are, well, our eyes are going to dilate so we can see to fight or flight. We're going to have more energy, and the glucose I spoke about, going to the muscles so that we can run or defend ourselves. And one of the things that happens is that the brain is shut down from higher executive functions. It's basically survival mode. And when the brain goes into the survival mode and the chemistry of our body goes into that sympathetic fight or flight, we're just not at that point wired to make cognitive decisions or higher executive functions and hold on to memory.
And so with those physiological changes, how can unresolved stress be linked to chronic pain then? Because usually if you're in fight or flight, you're not really feeling any of that sort of stuff, right? It's that adrenaline jump so that you can go and lift a car or run a marathon or whatever, right?
Right, right. Just as you said, when we are in that HPA axis or that stress response, sympathetic fight or flight, we typically don't feel pain quite so much. But there's a difference between us burning off the adrenaline and the epinephrine by fighting or by fleeing. And when we're sitting at our desk and we're just dealing with the ongoing mental, emotional stresses of life. Um, we just keep in this loop, and we keep in this loop, and at that point, the body does perceive that we're not really running and we're not defending ourselves, and so it's kind of a low level dysfunction, and pain can break through. So it doesn't necessarily stop us from feeling muscle, skeletal, body types pains.
And how can someone know if they are suffering from that HPA dysfunction?
I give a questionnaire in my office, and it kind of will red flag how many of the things somebody may be having that are directly related to the stress reaction. But I would say there's kind of four primary areas that I'm looking to evaluate, and one is, how are you sleeping? Just so important. If somebody's not sleeping at 7 or 8 hours a day, or if they can't go to sleep, or if they wake up during the night and they can't go back to sleep, and their mind's constantly going, and these cortisol levels are imbalanced. So poor sleep is one of the first things that indicates we have a HPA dysfunction or a stress reaction that's unresolved. One of the other things is that blood sugar imbalances. So if somebody does have that brain fog, or they can't go more than 4 or 5 hours without having some food, without getting a headache, or that hangry feeling if they haven't had food, that blood sugar imbalance is often an indication that there's a stress response or unresolved stress going on. It's important to say that perceived stress is actually a stressor, and that mental emotional response to what one person might perceive as not a big deal, but if to you it is a problem, then that perceived stress is definitely going to create a reaction. So I'll ask questions about family health and loved ones and work environment to see if there might be that hidden stressor that they're just not identifying as affecting them physiologically. Um, and chronic pain in and of itself can create that first, or will be that first indication of somebody's stress, because that will often help us understand that there is an underlying inflammatory response going on. So if we have unresolved inflammation because of poor diet or injury, that is a sign that the stress reaction or the stress response is being overloaded.
And if someone is suffering from an HPA dysfunction, can that be corrected without clinical support, or generally you need to work with your doctor to get that resolved?
Again, I think it's the level of stress, both the quality or the perceived level of stress and how long it's been going on, and the individual's coping strategies. I think we have to look at all those variables, and there's a lot of online resources right now. And so if somebody has low level stress and they feel it and they perceive it and they're not sleeping well, they can probably go online and they can Google the information, and they can have some strategies that they can try, and that may work for an individual based on where they are. Um, but when it gets to the point that it's more severe and it's been ongoing for long periods of time, I believe that that individual needs not just information, but they need a strategy. And that's where the clinician steps in and really can do some blood testing or saliva testing or these more detailed uh, questionnaires to try to figure out exactly where's the high impact area for us to intervene and help this person resolve. So not everybody may need clinical support, but I think it certainly is helpful and beneficial.
And you were talking about how exercise is a good tool when we were talking about your three pillars there, but that it can also end up being a form of stress. So, how do you kind of know at which point you've gone too far when it comes to that exercise piece?
Once again, it's individual. It depends on that person's fitness level. It depends on what type of an exercise load they can tolerate to begin with. Once the additional stress reaction or the stress response kicks in because of other stressors, because exercise is itself recognized as a physical stressor. And so if you are exercising, it mobilizes that sympathetic stress response. And when the exercise is done, then the body flips into that recovery place of paraphysiological rest and relaxation and recovery. So if somebody doesn't have a lot of stress in their life, if their family environment is good, if everybody's healthy, if their job is one that they enjoy and there's not a lot of additional stress there, and they've been exercising for very long periods of time at certain levels, that stress is going to be positive. It's going to be beneficial. It's not going to be an overload, because when it is appropriate levels, it literally will reduce our stress hormones like adrenaline and cortisol, because it will consume them in the muscular contraction of exercise. And it releases endorphins, and they're basically a natural painkiller, and they are a mood elevator. But if I have that individual who is working the 70 and 80-hour work week, a lot of responsibility both at work and at home, and they're trying to burn off that stress, if you will, by exercising 7 days a week, I know that individual is just draining their metabolic reserves. We only have a cauldron of so much at any point in time that we can draw upon in order to manage stress. I talked about that allopathic load, that is the cost to the body of dealing with the stress. And if somebody is just bleeding that reserve, so to say, if they put too much exercise on top of it, they've now tipped the scale against themselves. So it's based on the individual.
And then sometimes people can become essentially addicted to some of these coping mechanisms like exercise or like screen time. Like people try and just quote unquote unwind with their favorite series on Netflix or whatever, but those aren't always
Right.
necessarily healthy coping mechanisms and can become addictive when done in excess. So what are some of the steps that someone could take to address this if they've gotten to that point where they're either on the verge of addiction or using it as a crutch?
I think that if it's too much of a good thing or an okay thing, like screen time or exercise, um, it's a matter of becoming self-aware. I talk to my patients about my AIM principle, that at any moment in time, they want to assess an environment, assess a situation, set an intention, and then move towards it. So the AIM, and I ask people to step back and to evaluate, well, how much exercise is too much? Because most people can figure that out. And if they find that they're not able to step back and assess the environment and make healthier decisions, then it's probably time for them to sit down with a professional or a talk therapy or somebody to help them manage that. Um, Sometimes just I find in my practice, if I help my patients be aware of what those boundaries are and try to give them parameters of what is too much, uh, then most people can step back and go, oh, wow, okay, that is too much screen time, or maybe I am hurting myself by exercising too much. Now, on the flip side of that coin, if somebody is stepping into other coping strategies like alcohol or drugs to try and numb themselves from dealing with the stress, that individual, in my opinion, they really need to seek professional help quickly. We want to make sure that we don't end up with addictions that are going in a direction of really compromising our lives.
Awesome. And so when or how much screen time should people be getting, or when does it become too much, in your opinion?
Well, we talk about screen time as an environmental stressor. Um, and that particular stressor, the data is really just starting to come in and compile. And there's differing thoughts on this, but I think the general concession is that outside of your work environment, about 2 hours a day is about the maximum screen time relative to computer, TV, gaming, phone, etc. And we talk about probably staying at least an hour away from bedtime so that all the stimulation of the screen and activation of the eye and the retina, and it raises blood sugar levels and blood pressure when in excess. We want to make sure that those things are calming down before we go to bed. Again, it's very individual. I find that patients who work at computer screens all day long, and some people working now with multiple computer screens more virtually, as opposed to sitting in a conference room and interacting with people. I'm asking my patients that live on the computer all day long to consider that less than 2 hours of screen time at the end of their day is probably something to think about.
Yeah, I mean, that makes sense. I think too, especially over the last couple of years with people working from home and whatnot, even roles that maybe were more or less on the computer are now more so than previously, which definitely has an impact as well.
Right.
Well, I really appreciate you taking the time to chat with me today. And if our listeners want to learn more from you, they can go to your website at www.drpamwilson.com, correct?
That is correct. That's correct.
And they can also find you on Instagram?
Yes, I am on Instagram and on Facebook. Dr. Pam Be Well is the link, and it's just been a pleasure speaking with you. And it's so nice to be in these podcast environments where it's just open conversation and trying to give people information to not only have better information, but hopefully developing some strategies to get into a healthier place in life.
Thank you for listening to Supplementing Health. For more information about our guests, past shows, and future topics, please visit aor.ca/podcast or aor.us/podcast. Do you have a topic you want us to cover? We invite you to engage with us on social media to request a future topic or email us at marketing@aor.ca.